overall, the autism is increasing in prevalence at an alarming rate. The study tests 8-year-olds who were born in 2014. The ASD prevalence rate in 8-year-olds is now 1 in 31. Shocking. There's an extreme risk for boys. Overall, the risk for boys of getting an autism diagnosis in this country is now 1 in 20. And as high in California, which has the best data collection. So it probably also reflects the national trend, 1 in 12.5 boys. This is part of an unrelenting upward trend. The prevalence 2 years ago was 1 in 36. The first ADDM survey was 22 years ago, when prevalence was 1 in 150 children. In all the core states, the trend is consistently upward, and most cases now are severe. So about 25% of the kids who are diagnosed with autism are nonverbal, non-toilet trained, and have other stereotypical features, head banging, tactile and light sensitivities, stimming, toe walking, etc. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. They can provide a vulnerability. You need an environmental toxin. Autism destroys families. More importantly, it destroys our greatest resource, which are our children. These are children who should not be suffering like this. These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And clearly there are industries. This is coming from an environmental toxin. And somebody made a profit by putting that environmental toxin into our air, our water, our medicines, our food. And it's to their benefit to say, to normalize it, to say, this is all normal, it's always been here. But that's not good for our country. And it's not good for the press to not be more inquisitive, to not be more skeptical. And within 3 weeks, and probably we're hoping in 2 weeks, we're going to announce a series of new studies to identify precisely what the environmental toxins are that are causing it. This has not been done before. And we're going to do it in a thorough and comprehensive way, and we're going to get back to with an answer to the American people very, very quickly.
And are you open to following the science regardless of whether it confirms some of your expectations or not?
Yeah, I mean, we're gonna follow the science no matter what it says, and we will have some of the answers by September. It's going to be an evolving process. We're going to issue grants the way that it's always done to university researchers and others. We're going to remove the taboo. People will know they can research and they can follow the science no matter what it says, without any kind of fear that they're going to be censored, that they're going to be gaslighted, that they're going to be silenced, they're going to be defunded, delicensed, and we're going to give them permission to do this research. Thank you all very much.